trachea subdivides into two main bronchi, principal bronchi, right and left. Right is wider and shorter, left longer and narrower, and right principal bronchi has more vertical position than left bronchi. That is why if, for example, it's frequently children insert somebody into the nose, for example, Lego, and inspirate it in 90% of cases. This leg, if it's not fixed in larynx and continues into trachea, then it goes to the right main bronchi than on the left one, more frequently in right. And right principal bronchi subdivides into three. Superior, what else? Middle and inferior. And on the left side, we have two principal bronchi, superior and inferior. Then bronchi labaris, no, that is principal bronchi, that is bronch of the first order. Bronchi labaris, they are bronch of the second order. And they subdivide into segmentary bronchi. We have three segments in superior lobe of the right lung, 2 segments in middle lobe, and 5 segments, 1, 2, 3, 4, and 5 in inferior. On the left side, we have 5 in superior lobe and 5 in inferior. 1, 2, 3, 4, and 5. Segmentary bronchi, they are bronch of the third order. And from third order, all another bronchi subdivides into two bronchi of the fourth order, another 2 of the fifth order, then 2 bronchi of the 6th, then 7th and 8th. Bronch of the 8th order has name bronchus lobularis. You should remember that second order, that is bronchus labaris, because it goes to the lobe, and 8th order bronchus lobularis, because it's insert into lobule. It is secondary lobule, lobulus pulmonis secundarius. And bronch of the 8th order continues to divide into 16, I draw here, from 16 to 18, sometimes 20, terminal bronchioles. They are bronchiole terminalis. Bronchiole terminalis. Terminal bronchioles, that is last bronch where which conduct air, that is bronchial tree, and function of bronchial tree only conduct air. And then from terminal bronchial, I take one of these terminal bronchial. This is bronchiole terminalis. This is one terminal bronchial. And terminal bronchial continues to divide into respiratory bronchioles. Bronchiole respiratory. And respiratory bronchioles has alveoli pulmonis. Alveoli pulmonis. That is places where exchange of gases take place. Clear?
Yes.
Only here. This is diagram of alveolar tree. Here, bronchial tree. It's conduct air. And this one, alveolar tree, where exchange of gases. And this is terminal bronchial, and now it is respiratory bronchial. Bronchiole respiratory. Respiratory bronchioles, and that is first order of respiratory bronchioles, then second order, then third and fourth. 4 orders. Here it is third and fourth. everywhere should be alveoli pulmonis. Everywhere. And respiratory bronchial of the last order continues into alveolar duct, which finish with alveolar sac. It's maybe 2 ducts, maybe 3 ducts from respiratory bronchial of the last order. It is, I draw 2 alveolar ducts. And now, all of these structures, all of these structures which start from one terminal bronchial, that is SNS. SNS, that is anatomical and functional unit of the lung. Who remember what is the unit of the liver? Anatomical and functional. Lobule. In lung, anatomical and functional unit, that is SNS. Acinus in Latin, acinus. Then these ducts and alveolar sacs, which start from one respiratory bronchial of the last order, this or this, that is primary lobule. Primary lobule. This is primary lobule, and heat is the same. Primary lobule. Alveolar ducts. It's maybe 1, sometimes 2, maybe 3 ducts, which start from respiratory bronchial of the last order. What is the last order? No. Fourth. That is primary lobule. Primary lobule. And this part of the lung, that is secondary lobule. Secondary lobule, that is part of parenchyma of lung, which has 1 centimeter in diameter. It separates from nearest lobules with the help of connective tissue, and into the apex of this lobule insert bronch of the 8th order, that is bronchus lobularis, that is secondary lobule. It is primary lobule in SNS, and secondary lobule that is part of the lung near of 1 centimeter in diameter. Clear? Well, these 2 diagrams you need to draw next Wednesday. Now, what we can see in preparation. Do you remember that today we have lecture?
Yes.
And who will Russian professor from Izhevsk? She will deliver a lecture, and I want to ask you not only to come trachea, where is right and left bronchi. Right principal and left. It's longer and narrower. It's wider and shorter. It is three lobar bronchi. Bronchus labaris superior, bronchus labaris medius, and bronchus labaris inferior. On the right, on the left side, only 2, superior and inferior. Then, what is what is this lung? What is this? Is it right?
Left.
Or left?
Left. 2 lobes.
2?
3.
3 lobes. Superior lobe, middle lobe, and inferior lobe. That is right lung. And this fissura horizontalis, horizontal fissure, it is at the level of fourth rib. And this is oblique, fissura obliqua. Fissura horizontalis, it separates superior from middle lobe, and oblique fissura obliqua between middle and inferior. On the left side, only oblique fissura obliqua. What else? Look here. This is secondary lobules. This place, here it is. That is secondary lobules. We can see connective tissue. This is connective tissue between this lobule and this, between this and this. That is secondary lobules. that is near of 1 centimeter in diameter. Connective tissue separate them one from another, and that is the base of this lobule. And apex is look to the root of the lung, and into the apex insert bronch of the 8th order. Clear? How many acinas? How many acinas in one secondary lobule? Try to answer. Look at my diagram. Look at my diagram. This is bronchus lobularis, and it subdivides into how many terminals?
16 to 18.
And one terminal bronchial gives how many acinas? One acinus. One terminal bronchial continues into acinus. That is why how many acinas in
16 to 18.
16 to 18. In this one of these secondary lobule present from 16 to 18 acinas. Clear? Surfaces. This is facies castalis attached to ribs. This is diaphragmatic surface because it's attached to diaphragm. And medially in this place, this is medial surface, and it consists of mediastinal part, pars mediastinalis, and this is this part which attached to vertebral column, that is vertebral part. That is apex of the lung, it is base of the lung, and root of the lung, it consists of, this is bronchus principalis, what else? And vessels. It is a right lung that is superior position in principal bronchi, medial position, this is a pulmonary artery, and below of pulmonary artery, just a moment. Yes, this is pulmonary artery, and it is pulmonary vein. That is B bronchi, then artery, B, A, and then 2V, double V, VV, two pulmonary veins. That is, I can see only one, another is broken here. Double vein. We have two veins which start from lung and bring oxygenated blood from lungs to heart. That is why superiorly bronchi, middle position in artery, and inferiorly two veins. On the right side. On the left side, artery above, superiorly above of bronchi. Artery, then bronchi, and then two veins. A, B, V, V on the left side, B, A, V, V on the right side. It is all.